Maritza Henry, and I will be presenting to you medication-assisted treatment program. The purpose of this program is to prevent opioid relapse. The medication-assisted treatment program is made up of a group of multidisciplinary providers, including a medical doctor, nurse practitioner, registered nurses, and master-level social workers. The program will be offered in a co-located clinic setting. The social problem being addressed by the medication-assisted treatment program is opioid addiction. Opioid addiction includes dependence on prescription opioid medication, heroin, and fentanyl. Opioid addiction has been a public health concern since 1991 and has reached epidemic proportions over the last few years. Many individuals that are addicted to opioids begin by taking prescription medications such as oxycodone that was prescribed to them by a medical doctor after some sort of injury or surgery for pain management. In fact, research shows that 4 out of 5 heroin users initially began opioid use by misusing prescription pain medication. What usually happens is the prescription pain medication will become difficult to obtain because it's costly, and individuals will switch to the more dangerous street drug, heroin. Opioid use is a public health concern because it presents many risks for individuals who engage in this activity. With the rise of opioid use, there is also a significant rise in drug overdoses, which is the leading cause of accidental death in the United States. In addition, there has been a rise in the spread of HIV and hepatitis C amongst intravenous drug users. According to research done by Littrell, intravenous drug use accounts for 1/3 of HIV cases, and over 60 to 90% of IV drug users have tested positive for hepatitis C. As a response to the opioid epidemic, the United States government has responded with a number of different preventive measures and interventions, one being medication-assisted treatment. The purpose of the medication-assisted treatment program is to prevent opioid relapse. Participants in the medication-assisted treatment program will receive one of 2 maintenance medications, methadone or buprenorphine, daily. So both medications work to block euphoric effects of opioid use, reduce cravings, and help individuals abstain from opioid use without experiencing withdrawal symptoms. The medication will be dispensed by medical staff at the clinic daily, and participants will be required to submit monthly urine drug analysis to ensure that they are not continuing to take opioids and benzodiazepines, as these medications can be deadly when taken with methadone. And participants will also be expected to attend individual therapy and group therapy on a weekly basis to aid in the development of relapse prevention skills. As far as outcomes for this program, previous research conducted by Fishman and his colleagues found that dispensing individuals a maintenance medication such as extended release naltrexone or buprenorphine over a 24-week period yielded favorable results for preventing opioid relapse. In their study, they found that at the 12-week mark, which is halfway through their study, 50% of the urine drug analysis were negative for opioids. Some of the short-term outcomes for this program include preventing opioid relapse and developing relapse prevention skills. Long-term outcomes of the medication-assisted treatment program include prolonged abstinence from opioids and other substances, and eventually having the clients taper off of the maintenance medication. The research question related to medication-assisted treatment and the population that it is intended to benefit is, For individuals struggling with opioid dependence, is the implementation of medication-assisted treatment versus abstaining from opioids without medication-assisted treatment more effective in preventing relapse? My hypothesis is that compared to individuals who do not implement medication-assisted treatment, individuals who implement medication-assisted treatment into recovery will be less likely to relapse. For this study, non-probability sampling will be used to obtain a sample size of 100 male and female adults. All adults above the age of 18 are invited to participate in the study, as well as adults from any racial and socioeconomic background. Since the program is already occurring and it's ongoing, 25 newly admitted participants will be recruited from the study each month until the sample size of 100 is reached. A purposeful sampling method approach will be used in this study. Participants will have to meet certain criteria in order to participate. So the criteria that participants will have to meet in order to participate in this program, they must identify as being opioid dependent. They must successfully complete a 5 to 7 day detox at an Orlando detox facility. Participants must not be pregnant. They must not be participating in a medication-assisted treatment program somewhere else. They must present no signs of psychosis, and they must not be taking benzodiazepines or opioid prescriptions that even if they were prescribed to them by a medical doctor. Okay, so this study will be conducted using a quasi-experimental time series design. There will be no control group in this study. A quasi-experimental time series design is being used because the study will not use randomization, and this design allows researchers to efficiently examine the effectiveness of medication-assisted treatment. We're using a time series design because the outcomes will be measured monthly for the duration of the program. The main outcome being assessed during this study is opioid relapse, which can be defined as returning to substance use after attempting to abstain from using. Relapse will be measured using urine drug analysis screenings as well as the Sobel and Sobel timeline follow-back assessment. Participants will be required to perform a UDA screening and complete the timeline follow-back assessment once per month for the duration of the program. The second outcome being measured is participants' development of relapse prevention skills. This outcome is going to be measured using a pre-test and post-test that was developed by the evaluator. The timeline follow-back tool is a tool that's used to track substance use during a designated time period, which will be each month. The tool is used to collect quantitative data. It is formatted as a calendar. Individuals will be asked to indicate on each calendar day whether drug use, opioid use to be specific, occurred. So on each day, if they used opioids, they will place a check mark, and if they did not use opioids, they will place a 0. Participants will be asked to complete this each month in addition to their UDA drug screening. The pre-test and post-test will be used to collect qualitative data. The pre-test and post-test will contain 5 similar questions, such as how much knowledge do you currently have on relapse prevention? When triggers arise, what kind of coping skills do you utilize to prevent use? And on a scale of 1 to 5, how much do you think the MAT program improved your quality of life, including health, happiness, and well-being? So the study will take place over a 6-month period from each participant's start date in the program. After being chosen for the study, participants will complete the pre-test questionnaire, which will assess their current knowledge on relapse prevention skills. Participants will begin dosing at the clinic daily after discussing their desired medication with the medical doctor. Throughout the month, nurses and social workers will administer the urine drug analysis as well as the timeline follow-back assessment for the participants' completion. When participants reach their third month in the program, they will be asked to complete the post-test as well as the timeline follow-back assessment and their monthly UDA. Data will be analyzed on an ongoing basis. Every month, researchers will analyze the data collected from urine drug analysis and record positive and negative drug screens. The timeline follow-back assessment will collect self-reported opioid use. The percentage of negative opioid drug screens will be calculated each month, as well as a percentage of individuals who self-report abstaining from opioid use on the timeline follow-back assessment. Researchers will analyze responses provided on the pre-test and post-test to draw conclusions on whether or not the program was effective in educating participants on relapse prevention skills. Researchers will calculate the rate of individuals that indicated the program aided in the development of coping skills, early recovery, and/or relapse prevention skills. So some implications for social work practice and future directions. Although other MAT programs have been proven to yield favorable results, medication-assisted treatment continues to be underutilized because of the stigma surrounding the use of medication to replace using a dangerous substance such as heroin and fentanyl. Many opponents of MAT view the complete abstinence approach as the only way to maintain complete sobriety. Although the approach works for some, it does not work for everyone because recovery is not one size fits all. MAT is an evidence-based approach that has been proven to decrease the rate of opioid relapse. As social workers, it is our duty to facilitate recovery and well-being of vulnerable populations. Social workers are needed to educate individuals on addiction and programs such as MAT, and are also needed to manage these programs. Social workers can help break the stigma surrounding MAT with our knowledge and skills. With more education on MAT, the intended outcome is for the state and government to provide more funding for MAT programs in Florida and nationwide. We also hope to increase availability of grants so that underprivileged individuals have the opportunity to participate in these programs. With more access to medication-assisted treatment, individuals struggling with opioid addiction will be empowered to take the next step towards recovery and have this service available to them as an option. Thank you very much for watching my presentation. I hope it was beneficial to you, and have a great day.